Gentlemen, let's talk about something most men won't discuss openly, but almost every man over 50 wonders about. What really happens to your body when you go through a long stretch without sexual activity? Maybe you've been single for a while. Maybe health issues have changed things. Or perhaps life just got complicated and intimacy took a backseat. Whatever the reason, you've probably heard the phrase, use it or lose it, and wondered if there's any truth to it. I'm Dr. Mariana, a specialist in men's health with over 3 decades of experience helping men navigate these exact concerns. And today I'm going to give you the honest, science backed answer. And I promise you, much of what you've heard is completely exaggerated. But there are some real changes that happen, and it's important you understand them. Stay with me because by the end of this video, you'll know exactly what's myth, what's real, and most importantly, what you can do to maintain optimal health and vitality, whether you're sexually active right now or not. Before we dive in, if you're a man over 50 who's serious about understanding your body and taking control of your health, make sure to hit that subscribe button and turn on the bell. I share practical, science-backed tips made just for you. And if this topic speaks to you, type 1 in the comments. If not, type 0, so I know how to serve you better next time. Let's start by clearing up the biggest myths I hear in my office almost every week. These are the fears that keep men awake at night, the worries they're too embarrassed to ask their doctors about. And I want to put your mind at ease right from the start. Here's the truth. Your body doesn't just shut down because you've taken a break from sexual activity. You're not going to wake up one day and find that everything has permanently stopped functioning. Your tissues, your nerves, your hormonal system, they're all remarkably resilient. The human body is designed to adapt, to recover, to bounce back. It's been doing this for thousands of years. I've had patients come into my office terrified that because they hadn't been intimate in 6 months or a year, they were somehow broken beyond repair. And every single time, I've been able to reassure them that this simply isn't how the body works. Your reproductive system doesn't have an expiration date that clicks off after a period of inactivity. Again, not true. Yes, hormones and psychological factors play a role, but taking a break from sex doesn't doom you to a lifetime of zero desire. Your body is adaptive, and desire can and does return when circumstances change. I've seen men in their 70s who hadn't been intimate in years suddenly rediscover their desire when the right circumstances presented themselves. Libido is influenced by so many factors: stress, sleep, diet, exercise, emotional connection, and yes, hormones. But it's not a light switch that turns off permanently. Think of it more like a flame that can dim, but rarely goes out completely. With the right conditions, it can always be rekindled. This is perhaps the most frightening myth, and I want to address it directly. Your anatomy does not permanently shrink or become damaged from lack of use. While there can be temporary changes in tissue elasticity, which we'll discuss in detail, these are not permanent alterations to your physical structure. Your body maintains itself even during periods of inactivity. Now, here's what is true. There are some real measurable changes that can happen to your body during extended periods without sexual activity. These changes aren't catastrophic, but they are worth understanding so you can take simple, proactive steps to maintain your health. Let me walk you through the biology in plain language. No medical jargon, just honest, clear information that you can actually use. Your entire reproductive and urinary system depends on 3 things: blood flow, muscle tone, and hormone levels. Think of these as the 3 pillars holding everything up. When all 3 are strong, your body functions optimally. When one or more becomes weak, you start to notice changes. The first pillar is blood flow. When you have regular sexual activity, whether with a partner or by yourself, you're essentially doing maintenance work on your circulatory system. Sexual arousal increases blood flow to the pelvic region. That increased circulation keeps tissues healthy, elastic, and well-nourished. It's like watering a plant regularly. The tissue stays supple and responsive. Every time you experience an erection, blood rushes into the spongy tissue of the penis, expanding it and keeping those tissues flexible. This happens not just during sexual activity, but also during sleep. Nighttime erections, which most men experience several times per night without even knowing it, are your body's way of performing maintenance. It's like your body running a systems check while you sleep. The second pillar is muscle tone. When you reach climax, your pelvic floor muscles contract rhythmically. These contractions are like a natural workout for those muscles, helping them stay strong and toned. Strong pelvic floor muscles are critical not just for sexual function, but also for bladder control and overall core stability. Many men don't even know they have pelvic floor muscles. let alone understand how important they are. These muscles form a hammock at the base of your pelvis, supporting your bladder, your bowel, and playing a crucial role in erectile function. When they're strong, everything works better. When they're weak, problems start to emerge. The third pillar is hormone levels. Sexual activity interacts with your hormones in complex ways. Testosterone, the key male hormone, influences desire, energy, mood, and even cognitive function. Regular activity helps keep these hormonal pathways active and responsive. It's a feedback loop. Activity stimulates hormones, and hormones stimulate desire for activity. Now, I know some of you are thinking, okay, so what actually changes if I'm not sexually active? That's exactly what we're about to cover in detail. Let's break down the four most common changes men experience during extended periods without sexual activity. I want you to understand not just what happens, but why it happens, and most importantly, what you can do about it. The biology. Your penile tissue contains something called smooth muscle. This isn't the kind of muscle you flex at the gym. It's a specialized tissue that needs regular oxygenated blood flow to stay healthy and elastic. During an erection, blood rushes into this tissue, stretching it and keeping it flexible. When you go for long periods without erections, and this includes nighttime erections, which are actually nature's way of doing maintenance, the tissue can start to lose some of that elasticity. Think of it like a rubber band that hasn't been stretched in a while. It still works, but it might feel a little stiffer at first. There's actually a medical term for this: penile fibrosis. Now, before you panic, understand that mild changes in tissue elasticity are completely normal and usually reversible. We're not talking about severe fibrosis, which is a different medical condition. We're talking about the natural response of tissue that hasn't been regularly exercised. The practical reality. Some men notice that after a long break, erections might feel less firm initially, or it might take a little longer to achieve full hardness. The first time you're intimate after a long break, things might not work exactly as you remember. This is normal. It doesn't mean anything is wrong. I had a patient named Richard, 64 years old, who came to me after being widowed for 2 years. He had started dating again and was terrified because his first intimate encounter hadn't gone as expected. He was convinced something was permanently wrong. After examining him and reviewing his health, I was able to reassure him that his body simply needed time to readjust. Within a few weeks of regular activity, everything returned to normal. The emotional impact. This can be worrying the first time it happens. You might think something is permanently wrong. You might feel embarrassed, anxious, or even ashamed. But understanding that it's a natural, reversible response to decreased activity can ease a lot of anxiety. Knowledge is power, and knowing what to expect removes much of the fear. The biology. Your pelvic floor muscles are a group of muscles that form a supportive hammock at the base of your pelvis. These muscles control urination, support your bladder, and play a critical role in erections and climax. When you orgasm, these muscles contract rhythmically, keeping them toned and strong. Think of these muscles like any other muscle in your body. If you stop exercising your biceps, they'll eventually lose strength. The same principle applies to your pelvic floor. Regular contractions, whether through sexual activity or targeted exercises, keep these muscles in good condition. What many men don't realize is that weak pelvic floor muscles can contribute to erectile dysfunction, premature ejaculation, and urinary issues. These muscles are the foundation of male sexual health, yet most men have never even heard of them. The practical reality. When you're not sexually active for extended periods, you might notice subtle changes in bladder control. Maybe you feel a slight urgency you didn't feel before. Maybe you notice occasional minor leakage when you cough, sneeze, or lift something heavy. Maybe you find yourself getting up more often at night to urinate. These changes are often so gradual that men don't connect them to sexual inactivity. They assume it's just aging. And while aging does play a role, maintaining pelvic floor strength can significantly slow or even prevent these changes. I remember a patient named Thomas, 58 years old, who came to me complaining about frequent nighttime urination. He was getting up 3 or 4 times per night, and it was affecting his sleep and his quality of life. After ruling out other causes, I recommended pelvic floor exercises. Within 6 weeks, he was down to once per night. He couldn't believe such a simple intervention could make such a difference. The good news. Pelvic floor exercises, often called Kegels, can maintain and restore this muscle tone whether you're sexually active or not. These exercises are simple, can be done anywhere, and take only a few minutes per day. We'll cover exactly how to do them later in this video. The biology. Testosterone is the primary male sex hormone, And it influences far more than just sexual desire. It affects your energy levels, your mood, your cognitive function, your muscle mass, your bone density, and your overall sense of well-being. Testosterone levels naturally decline with age, typically starting around age 30 and continuing gradually throughout life. Regular sexual activity helps keep the entire hormonal system engaged and responsive. Some research suggests that men who remain sexually active tend to maintain slightly better testosterone levels than those who don't. The relationship is complex and bidirectional. Testosterone influences desire, and sexual activity influences testosterone. There's also evidence that orgasm triggers the release of other beneficial hormones, including dopamine, oxytocin, and endorphins. These hormones contribute to mood regulation, stress reduction, and overall well-being. When you're not sexually active, you're missing out on these regular hormonal boosts. The practical reality. During long stretches without activity, some men notice they feel less motivated, less energetic, or just generally flat. Colors might seem less vibrant. Activities that used to excite you might feel dull. You might find yourself less interested in socializing, less driven at work, or simply less engaged with life. Libido can decrease, which creates a self-reinforcing cycle. Less desire leads to less activity, which can further decrease desire. This cycle can be difficult to break without conscious effort or intervention. I've seen this pattern countless times in my practice. A man goes through a difficult period, maybe a divorce, maybe a health scare, maybe just the stresses of life. Sexual activity decreases. Over time, desire decreases too. Eventually, he convinces himself that he's just not interested anymore, that this part of his life is over. But it's not over. The cycle can be broken. The emotional impact. This can feel like you're losing a core part of your identity. Many men tell me they feel less confident, less masculine, less like themselves. They describe a kind of emotional flatness, a loss of the spark that used to drive them. But understanding that this is often hormonal and therefore treatable can be incredibly reassuring. You're not becoming less of a man, your body is simply adapting to circumstances. And with the right approach, you can restore your vitality. The biology. Sex isn't just physical, it's deeply connected to mental health and emotional well-being. Regular sexual activity has been linked to lower stress levels, better sleep quality, improved mood, and even better immune function. This is partly because of the release of hormones like oxytocin, often called the bonding hormone, and endorphins, the body's natural feel-good chemicals. Physical touch, intimacy, and connection are fundamental human needs. We're wired for it biologically. When these needs go unmet for extended periods, it can affect us in ways we don't always consciously recognize. The practical reality. Men who go through long periods without intimacy sometimes report feeling more stressed, more anxious, more isolated, or experiencing poorer sleep. They might feel disconnected from their own bodies, almost like they're living from the neck up. If you're in a relationship, lack of physical intimacy can create emotional distance. Partners might feel rejected, confused, or unloved. Communication can break down, resentments can build. What starts as a temporary situation can become a long-term pattern that damages the relationship. Even for single men, the absence of intimate connection can create a sense of loneliness that goes beyond simply not having a partner. It's a loneliness of the body, a feeling of being untouched and undesired. The emotional impact. This is often the hardest part for men to talk about. Sex is about more than physical pleasure. It's about connection, vulnerability, being seen and desired. When it's absent, for whatever reason, many men feel a profound sense of loss. I've had patients break down in tears in my office, not because of physical symptoms, but because of this emotional weight. They feel like they've lost something essential, something that made them feel alive. And the hardest part is that most men suffer in silence because they don't feel comfortable talking about it. Here's the most important thing I want you to hear today, and I want you to really let this sink in. For most men, especially those who are younger or in their 50s and 60s with reasonably healthy hormone levels, these changes are not permanent. Your body is remarkably adaptive. It's designed to recover, to rebuild, to restore itself. When you resume sexual activity, whether with a partner or through self-pleasure, blood flow improves, tissues regain elasticity, muscles strengthen, and confidence returns. I've seen it happen hundreds of times. Men who thought their intimate lives were over discovered that they were just beginning a new chapter. However, if you're dealing with significant age-related testosterone decline or if you have underlying health conditions like diabetes, cardiovascular disease, or obesity, the changes can be more pronounced and may require medical support. And that's completely okay. There's help available. Seeking help isn't weakness, it's wisdom. Whether you're currently sexually active or not, here are 6 practical steps to maintain optimal health and function. Step 1. Stay physically active. Cardiovascular exercise improves blood flow throughout your entire body, including the pelvic region. Your heart pumps blood, and that blood needs to reach every part of your body, including the tissues responsible for erections. Regular exercise keeps your blood vessels healthy, flexible, and efficient. Strength training helps maintain testosterone levels. Research consistently shows that resistance exercise, especially compound movements like squats and deadlifts, can boost testosterone production. Flexibility work supports overall function and reduces the risk of injury. Even a brisk 30-minute walk daily makes a difference. You don't need to become a gym rat, you just need to move your body regularly. Step 2. Practice pelvic floor exercises. You don't need to be sexually active to keep these muscles strong. Simple Kegel exercises can be done anywhere, anytime, without anyone knowing. Here's how to do them. First, identify the right muscles by stopping urination midstream. The muscles you use to do this are your pelvic floor muscles. Once you've identified them, contract these muscles for 5 seconds, then relax for 5 seconds. Repeat this 10 to 15 times, 3 times per day. As you get stronger, you can increase the duration of the contractions and add more repetitions. Some men find it helpful to do these exercises at regular times, like while brushing their teeth or sitting at red lights. Step 3. Consider solo activity. Even if you're not in a relationship, maintaining regular sexual function through self-pleasure helps preserve blood flow, muscle tone, and hormonal responsiveness. This keeps the entire system active and engaged. There's absolutely no shame in this. It's legitimate health maintenance, no different from exercising or eating well. Many urologists, myself included, actually recommend regular ejaculation as part of prostate health maintenance. Step 4. Prioritize quality sleep. Sleep is when your body does most of its repair and maintenance work. It's also when you experience nighttime erections, which help maintain tissue health. Poor sleep disrupts hormone production, including testosterone. Aim for 7 to 8 hours of quality sleep per night. Create a cool, dark sleeping environment. Limit screen time before bed. Avoid caffeine and alcohol in the evening. Good sleep habits support every aspect of your health, including sexual function. Step 5. Manage stress effectively. Chronic stress is one of the biggest enemies of sexual health. Stress hormones like cortisol directly interfere with testosterone production and sexual function. When you're in fight or flight mode, your body deprioritizes reproduction. Find stress management techniques that work for you. This might be exercise, meditation, deep breathing, time in nature, hobbies, or social connection. The specific technique matters less than actually doing it consistently. Step 6. Get your hormones checked. If you're experiencing persistent low energy, decreased libido, mood changes, or difficulty with erections, ask your doctor to check your testosterone levels. This is a simple blood test that can provide valuable information. If your levels are low, hormone replacement therapy might be appropriate and can dramatically improve quality of life. This isn't about vanity or chasing youth. It's about maintaining the hormone levels your body needs to function optimally. While most changes are normal and reversible, there are a few warning signs that require prompt medical attention. Sudden complete loss of ability to achieve erections, including nighttime erections. Pain or discomfort with erections or ejaculation. Significant changes in urination like severe urgency, pain, or blood in the urine. Lumps, bumps, or changes in the testicles. Profound fatigue, depression, or other symptoms that interfere with daily life. Remember, erectile dysfunction can be an early warning sign of cardiovascular disease. The blood vessels that supply the penis are smaller than the ones that supply the heart, so problems often show up there first. If you're having persistent issues, don't ignore them. They could be your body telling you something important about your overall health. I want to address something that doesn't get talked about enough: the emotional weight of these changes. Many men tie their sense of masculinity, confidence, and self-worth to sexual performance. Society reinforces this constantly. So when things feel different, when the body doesn't respond the way it used to, it can trigger deep feelings of inadequacy, shame, or even depression. You might feel like you're becoming less of a man. You might feel like your best years are behind you. You might feel like you're letting your partner down, or like you're no longer desirable. Let me be absolutely clear. Your worth as a man is not measured by sexual frequency or performance. Your value as a human being has nothing to do with what happens in the bedroom. Your body is doing exactly what bodies do. It's adapting to circumstances, to age, to life. And with the right understanding and sometimes simple interventions, you can maintain vitality and function for many, many years to come. I've seen men in their 80s with active, satisfying, intimate lives. Age is not the barrier we often think it is. If you're not currently sexually active because of circumstances beyond your control, maybe you're single, maybe your partner has health issues, maybe you're dealing with your own health challenges, you haven't done anything wrong. You're not somehow failing. Life happens. What matters is that you take care of your overall health and stay informed. So, bottom line, do you use it or lose it? The answer is not in the catastrophic way most men fear. Yes, your body benefits from regular sexual activity. Yes, there are real changes that can happen during extended periods of inactivity. But these changes are generally mild, gradual, and reversible. What matters most is that you listen to your body, stay informed, and don't let fear or shame keep you from seeking help when you need it. Knowledge removes fear, understanding creates confidence, and taking action, even small actions, can make a profound difference. Your best years don't have to be behind you. With the right approach, the right information, and the right mindset, you can maintain vitality, confidence, and function well into your later years. I've seen it happen countless times, and I believe it can happen for you too. If you found this helpful, please share it with someone who might benefit: a friend, a brother, a father. These conversations need to happen more openly. Men's health shouldn't be a taboo topic. Leave a like to help this message reach more men, and subscribe to the channel with notifications on so you don't miss future content. Remember, age doesn't define your vitality. Small, informed changes can bring real freedom and confidence. Your body is more resilient than you think. Your best days are not behind you, they're being rebuilt, starting now. I'm Dr. Mariana, and I'll see you in the next video. Stay healthy, stay informed, and most importantly, stay confident. Remove these words.